Welcome to the Heart Attack Prevention channel on YouTube. We're starting the channel today, July 1st, 2022. Before this day is over 1,600 Americans will have a first heart attack. Hi, I'm Dr. Ron Digoma. I'm a practicing preventive cardiologist, board certified in cardiology, internal medicine, and clinical lipidology, with vast cardiology experience from over 40 years of clinical practice. We already lost 1 million Americans to COVID. 2022 appears to be the right time to launch our Save Your Heart campaign and save lives. Over 600,000 are expected to have a first heart attack in the US every year. That's 3 million in 5 years. That's the bad news. The good news is heart attack is largely preventable. This is important information that those who already had a heart attack wish they had known. Through the Heart Attack Prevention channel, we are reaching out to those millions of older adult Americans who are at high risk for having a heart attack in the next 3 to 5 years, their families and their healthcare providers. The videos we create are generally less than 15 minutes long, easily understood, practical, relevant, and applicable now. In addition to showing videos from Save Your Heart campaign, we are also creating educational videos to correct specific medical disinformation in social media about heart attack prevention. Let us begin. This is an acute heart attack in progress. This is what we are trying to help people avoid. We'll be talking about this later. For now, let's go back to this slide shown in the introduction video. 600,000 largely preventable first heart attacks a year, 1,600 a day. That's 5 jumbo jet loads of Americans. 3 million in 5 years. That's more than half the population of Norway. The total economic burden of cardiovascular disease, of which heart attack is the major component, is about $1 billion a day. And if we maintain the status quo, it is projected to reach $1 trillion a year by 2035. The big surprise is they are largely preventable. We have the diagnostic tool to detect coronary plaques years before a heart attack strikes. We have proven effective, mostly generic medications to prevent heart attack. We have a large volume of scientific data from clinical trials to support that heart attack is largely preventable. You may be asking, preventable for how long? Since when? For over 2 decades now. And you may be asking, how many did we lose over that time? A lot. That's for another video. If you or your family have not yet been impacted, you are just lucky now, but it's only a matter of time. John and Margaret's stories and many others are one of the reasons we are launching the Save Your Heart campaign. These people, they don't know you, through their extraordinary kindness, are willingly sharing their stories to save you. Stick around until the end, and I will tell you what questions you need to ask your primary care physician and cardiologist on your next visit. These are video clips from the Widowmaker documentary. The producer, David Bobbitt, through Ivor Cummings, gave us permission to use any and all video clips. Our gratitude to them. Watch and listen to John as he tells his story. You will also hear comments from my colleagues, other preventive cardiologists.
On May 6, 2009, I was playing softball on a field just like the one behind me. Sat down in the dugout in between innings. Had no warning signs, no complaints. I didn't feel sick or anything like that. Next thing you know, I woke up in an ambulance, somebody telling me how lucky I was. What happened, I learned, is that I was sitting in the dugout and I just passed over. I was clinically dead for 3 to 5 minutes. I was told I had no pulse, I was turning blue. Fortunately, two mothers kept me sustainable by doing CPR on me, and police officers had an automated external defibrillator in their car. It took 3 shocks in order to get me aroused again. This all happened on the field, and I woke up in the ambulance. I didn't know what happened, and the ambulance driver said to me, "You're a very lucky guy," and I really couldn't figure out why I was so lucky.
Not everybody is so lucky. Every minute of every day, somebody dies of a heart attack in America. It's the nation's biggest killer. More frightening than that is that a huge number of the people who die drop dead without any warning they've got heart disease.
About a third of patients, the first event is sudden death. And the reason is the disease is silent.
When I got to the hospital, they told me there were two major blockages in my left anterior descending artery. It's called the Widowmaker. It's a 99 and a 95% blockage. And they said it was an absolute miracle that I was still there.
2/3 of men and half of all women, the first sign or symptom is that they have a heart attack or die. You don't know you have it until you're dead.
And it doesn't have to be that way.
Heart attacks and strokes are absolutely preventable. The science is a slam dunk.
Thank you, John. Yes, you're lucky. Some people are not as lucky. Here's Margaret's story.
Met Margaret on the southeast side of Cleveland, Ohio, which pretty much borders the beginning of the suburbs. I was 11 years old at that particular time. Margaret would have been 13. We actually came together when I came back from the Marine Corps. I decided to go back to the old neighborhood just to see who was hanging out. And the only person that was standing there when I got there was Margaret. She was standing in her front yard watering her mom's roses, and I walked up and said, "Hey." And the rest is history. I like to think that I was a good guy, but you couldn't tell that by my actions. I'm a man's man. I'm in the Marine Corps. I had a 30-year tenure in the steel industry. Played sports, played hard sports. I became that irascible reprobate, drinking, drugging. I just made so many crazy mistakes and injured a lot of people, particularly Margaret, who always stood at ground zero. She would always tell me, "You know what? I will always love you." I meant that. You will be the only man I will ever love. But that doesn't mean that I don't hate what it is you're doing. I don't hate you, but I hate what it is you're doing. God put me to work in 2002, about 3 months after my job in the steel industry came to an end. And in 2006, trusting in God, we gave up everything in our life. We were enrolled in Pacific Lutheran Theological Seminary in Berkeley, California.
Oh boy, here comes the sign. My name is Margaret Monroe, and I'm a second-year student at Pacific Lutheran Theological Seminary.
Her first weekend on call, she preached for the hospital community and was on her way back to the supervisor's office. She had a massive coronary, and she died. And truly, my whole life stopped at that moment. I've never experienced anything as far as the depth of pain and grief that overwhelmed me. And it's not because of nostalgia or wistful memory type things. It is the truth. She was the very best part of me.
More women die of heart disease than men in the States every year since 1983. So it's a huge problem among women. 5 times as many women die of heart attack as breast cancer. Yet very few women have any knowledge of that or any inkling of concern about heart disease compared to breast cancer. So when we talk about the mammogram of the heart, that's at least 5 times more important to women than the mammogram of the breast.
Thank you, Pastor Carlton Monroe, for sharing us Margaret's story. What John and Margaret had in common was an acute heart attack involving a major coronary artery. This is a heart attack involving the proximal portion of the left anterior descending coronary artery, or proximal LAD for short. There are three components in a heart attack: a coronary plaque, a tear or rupture of the covering of the plaque, and a blood clot on the plaque. Most people don't realize that while a heart attack is sudden, the plaque component started many years before, even decades before. There's plenty of time to detect its presence, plenty of time to initiate optimal medical therapy. No, not stent, not heart bypass, but optimal medical therapy to stop its progression. Coronary artery disease, which is the medical term for plaque buildup in the coronary arteries, remains silent all that time until a tear or plaque rupture develops, which then triggers a blood clot to form within minutes. The clot grows until it completely obstructs the artery and blood flow stops. Heart muscles in that region start to die. That's what a heart attack is: dying of the heart muscles. You may be asking, why didn't they have a stress test? No, it's not likely to be helpful in both these two cases. Because they have no cardiac symptoms, a nuclear stress test would likely be normal. A nuclear stress test becomes abnormal only when a severe obstruction is present, 70% or more. What they need is a test that detects plaques much earlier, before they cause severe obstruction and before a heart attack occurs. This test is called coronary calcium scoring, a quick CAT scan of the heart without contrast. No IV needs to be started, no exercise involved, takes only a few minutes to perform, and costs about $100. Their test reports could have looked like any of this: a high calcium score with many calcified plaques. The blackened region are where the calcified plaques are located in the coronary arteries. Both John and Margaret would have been eligible to receive aggressive medical therapy to stabilize all plaques and prevent plaque rupture and, over time, induce plaque regression. The medical therapy is covered by Medicare and all insurance, but the $100 test needed to determine if they need this treatment is not covered. An added bonus in preventing heart attack is the same treatment that prevents heart attack also prevents stroke. Coronary calcium scoring was approved and recommended by the American Heart Association and the American College of Cardiology about 10 years ago. Even earlier in Texas, they passed a law, the Texas Heart Attack Prevention Bill, which mandates all insurance companies, including Medicare, to pay for calcium scoring. Other than Texans, presidents and astronauts get calcium scoring for free. Saving Your Heart campaign is all about stopping your heart attack before it happens, and earlier plaque detection by calcium scoring is the first step. On your next visit to your healthcare provider, if you are over the age 40, the older you are, the more important to have this conversation. Tell your healthcare provider that as much as possible, you want to avoid heart attack, stroke, stent, heart bypass in the future. Ask, do you think I have plaques in my coronary arteries? Do you think I need to have a calcium score? If not now, when? Or if you have coronary plaques or you had a previous heart attack, had stent before, ask, is my medical therapy sufficient to prevent plaque rupture, stop progression, and prevent heart attack? In the next video, we'll address the question that you're already thinking. If we have all the tools we need, an inexpensive, accurate, widely available diagnostic test that detects coronary plaques earlier before a heart attack, we have the effective medication needed, we have the scientific data proving heart attack is preventable, then why the 600,000 first heart attacks every year? Thank you for watching. We're making a case for less healthcare disparity and better equity, and will present convincing arguments that it's time to turn off the faucet instead of just mopping the floor. We cardiologists have become very good at mopping the floor. It generates large revenues for the cardiovascular disease care industry. For the sake of those over 600,000 fellow Americans, let us begin to turn off that faucet. Your health is your most important asset, so guard and protect it well. I hope you learned something of value, and if you did, share it with others and consider subscribing to help the channel grow. Visit us at heart-attack-prevention-channel.com. Use the comment section below and tell us your story and maybe help someone live. Register at saveyourheartcampaign.com and join our online community. Participate in our forum and take this journey with us. See you again soon.